Hi, thank you for joining us for the second episode of The Deepest Cut. I'm Dr. Sahar Sadughi, one of the cardiothoracic surgeons here at Mayo Clinic. It's truly an honor to have Dr. Mayra Guerrero, interventional cardiologist at Mayo Clinic, joining us today. Dr. Guerrero, thank you so much for your time.
No, thank you for this opportunity. I really appreciate it.
I really wanted to just start with a very broad question, just trying to understand what motivated you to become an interventional cardiologist.
I get that question often, and I did not really have to think. I think I'm very fortunate to know from very early age what I wanted to do. And I can just tell you like 3 moments in my life that I remember that the big decisions made or I realized. When I was a medical student, well, first of all, I knew I wanted medicine since age 16. So I joined medical school at age 17. So during my cardiology rotation at age 19, I saw a patient who had a STEMI, 52-year-old male, and was treated with thrombolytics. We're talking many years ago, before primary PCI. And I saw the EKG before and after and the amazing recovery. And I knew at that moment I wanted to do cardiology, and there was never plan B. It was going to be cardiology. And then fast forward many years, during my cardiology fellowship, and my first day of my cath lab rotation, when I saw all the things that we see in the cath lab, from diagnostic angiography to PCI at that time, it was day one, first case. I knew that I was born to be an interventional cardiologist. So I never had to think what I wanted to do. I had to think how to get there, because I knew what I wanted. I'm going to fast forward a few more years. During my interventional cardiology fellowship program, the first TAVR in the U.S. was being done at William Beaumont Hospital, and I was a fellow in the room. And when I saw the TAVR device being deployed, this is before TAVR it was even known as such. And when I saw the balloon being inflated and the deployment, those 5 seconds, there were so many thoughts in my mind, like no words. It was just like concepts. So quickly, I saw the future. I thought, oh my God, you can do that.
Right.
That moment, I knew that I was going to dedicate the rest of my career to structural valvular interventions. And like I said, the rest, it was just figuring how to do that, but not necessarily having to choose a different specialty. To me, it was just so clear, natural. I was born to do this.
Understood. I mean, it's amazing to know, like, within yourself that this is what you were meant to do. But I can imagine convincing those around you might have been difficult along the way, right? So knowing this about yourself, how did you approach difficulties when people questioned your motivation or your ability to do this path?
Yeah, I'm not sure anyone, or I'm not sure I realized that anyone questioned my motivation. I think to me it was very clear. But the ability, yes. In many ways, there were so many times during my career, and we're talking decades now, that people told me no, no because of this, no because of that. And I could tell you several examples. And it's a matter of don't listen to the no's, like don't listen to the pessimist. There will always be pessimists. There will always be someone who wants to stop you. What matters is what you think. Excuse me, and what you want to do. So, for example, many years ago, when I told my teachers in medical school in Mexico that I wanted to become a cardiologist and come to obtain the best training in the U.S., someone told me, "Oh no, that's not for poor people. Forget about that." Yes, it's true. I wasn't born in a family that has a lot of resources, so limited resources, but that's not a reason to tell a student that a student cannot do something. No, of course not. So what I do is I take the negative energy and I try to use that as a catalyst, as to help me get the strength to do something good for me. I realized since early age, people don't do things for you. You have to do that yourself. And I take all that energy and try to transform it into something good for me. So I think this doctor was not serious. He was just joking, most likely. But he could not have chosen better words to tell me, because when he told me that, I thought, okay, well, I'm going to prove him wrong.
Exactly.
So I'm worth for who I am and for what I believe in, not because of the money that I have or don't have. So the fee to take the USMLEs were $400, which I didn't have. And at that time, you could, as a recent graduate, you could cover a very small hospital, like hospital is for $10 a night for the night, and $2 per ER visit. So I worked every other night, and I studied and recovered the other nights that I was not working. So that meant 40 nights of work to get the $400. And when you work that hard to pay for the board exam, failing is not an option. You just have to pass, because you can't work another 40 nights and keep doing that. To make a long story short, then I took the exams and I came here. Another example, when I told a cardiologist that I wanted to be an interventional cardiologist, he said, "Oh no, that's not for a woman. You have a family. You have to think about your family. You should consider genetics. And it's a good field for a woman." And I'm like, well, another example, when I was going through some illnesses, we all can get sick at some point, right? And my doctor said, "Oh no, with that little body of yours," that was even before cardiology. "Why cardiology? No, you should choose something less demanding. You should consider ophthalmology." So, and all men, of course. And they're like deciding for me what I should do based on their beliefs, not based on what I knew. It was my calling. It's my calling. So I was not going to listen to them. This is talking about external limitations like resources,
of course,
illnesses that we all may go through, misconceptions about the role of a woman, in society. But there are other more overt barriers like real discrimination or racism that I have encountered many times. And I'll give you one example. When I was applying for interventional fellowship, very well-known institution with a good reputation on the other side of the country, called me after the interview, the program director, to say that, I just wanted to know that, I really wanted to take you in our program, but I can't because you're Mexican.
Oh my gosh.
And, at that moment, I kind of appreciated his honesty. Of course, again, all this, we're talking many years ago.
Sure.
And, I said, well, thank you for your honesty, and I really appreciate that. But just so you know, I can't control the place, where I'm going to be born. But even if I could, if I could go back in time, I wouldn't change that for anything in the world, because coming from that small town, from that family, is what has made me who I am. And if I had to give up, being who I am, or being Mexican just to fit in your program, I would say, well, thank you, but no thank you. I choose to stay Mexican and be Mexican. And you know what? It's not too bad to be Mexican. So many of us go through these moments where, for a variety of reasons, people tell you don't do it, or you can't do it because of this or because of that. I would say don't listen to that. If you know what you want to do and you feel the calling and you're doing it for a good reason, just don't listen to the pessimist and just follow your heart.
It's wonderful advice. Now, kind of fast forwarding, like you said, you've been doing this for decades. You've gone through all of this. You've basically gotten your goals accomplished. Still, I can imagine that there's some level of hardship, discrimination that you face, maybe less from your colleagues. But do you ever encounter this when interacting with patients? And how do you handle that?
The answer is yes, more than anyone can imagine. Even as of this day. And some patients may say more subtle comments, and other patients have very strong opinions, and I can give you an example of once there was a patient, I mean, it's been more than once, but this one example, there was a patient who did not want me to see her during the inpatient rounds. I was the consultant on service, and the prior consultant was a man, and we switched. And to make a long story short, she just said that, no, I don't want a female doctor, and she didn't want to talk to me, and she was very rude and very disrespectful, I have to say. So I tried to talk to her, and she did not understand, how that could be, disrespectful to me, or she couldn't understand the rules of the institution where we cannot just grant those wishes of not seeing someone because of race or gender.
Sure.
And my team members also tried to talk to this patient. It got to be very disruptive when the patient doesn't want to talk to you. You can't provide good care. It escalated, and there were other team members that came and talked to her, but she just could not understand that. And despite even someone in leadership position came and talked to her, she just didn't see that was
Sure.
right. And she decided to leave the institution against medical advice because she just did not trust a female doctor just for being a woman.
Interesting. When you encounter these situations, does it create self-doubt within you? When you see, let's say, even going back to this teacher in Mexico saying, like, this is not for you, or when you encounter a patient saying, I don't want to see her, how do you process that within yourself?
I don't think problems with self-doubt. I think more, sometimes there's a mix of, feelings, some negative and some positive. I just I look back where I come from, and I look into my family values. It's like your core values.
Of course.
And then once I remember all the sacrifices that my parents have to made, so that I could attend medical school. And if you go back to my grandmothers, they were very strong role models in my development, and just look at them, and I see what they went through. What I'm going through is nothing compared with what they had to face. So it reminds me, oh, this is nothing. Yes, you can. And going back to my grandmothers, I think it's important because, I really value the insightful teachings that they gave me. So one told me since very early age, if you want something, you have to work for it. And she was actually my first employer. So she sold, Avon products, and she got me into her workforce. And I think it's good to teach you, instead of giving something to you, show you to work for it and earn it yourself. And the other one had very strong spiritual, values, and she told me you should never be afraid of anything in life. You should only be afraid of God. And as long as you're doing something good, you should not be afraid of absolutely anything, my child. And then when I combine that, well, if I'm trying to do something good, I'm working for what I want, then why should I be afraid of anything? So just don't be afraid, work hard. And when I face, those problems, I think of all this, and I just move forward. Don't give up. Just keep working forward, and somehow try to, if you can, help them try to understand, how well prepared you are for what you need to do, and that we work as a team, and all that. And most of the times, patients understand.
Well, it's amazing to hear sort of your journey and your stories, and going back to when you were a child in Mexico to where you are now, and just seeing all of that. With all those lessons, when you encounter, let's say, younger residents that are going through similar struggles, how do you lift up people around you that may be struggling with these things?
Well, I think we need to tell them, and I did not know this until much later on. I think we need to tell them that, first of all, we need them. We need them. We want them. for who they are. I think they need to know they don't need to change who they are. Like someone told me, you can't because you're Mexican.
Mm-hmm.
No, we want them for who they are.
Mm-hmm.
If you're a woman, because you're a woman. If you're Latino or Latina, because you're Latina. If you're black, because you're black. If you're transgender, because you're transgender. We all belong. And the institutions, the world, they need us for who we are. So we should not change the essence of who we are. So I think I would like them to know that we need them just the way they are. We need them. And they shouldn't feel like they don't belong. They do belong. So we need to make sure that they know that during their early years or during their careers, because that can ease a lot of the pain. You know, a lot of this pain is not necessary. You know, if you know that since early years that you're valuable, that the society needs you for who you are, then that I think should ease the pain. So I would let them know that. Number one, we need them. Number two, they can. Yes, they can. Of course they can. And it doesn't matter what I think, what you think, what anybody thinks. What matters is what they think of themselves. So they need to know that they can. They may not be ready. They may have to go through a lot of struggles to get to point B, and it may not be a straight path. It may be a very convoluted path with a lot of obstacles that they have to overcome. But I know they can. And they need to know that they can. And they shouldn't listen to anyone who tells them that they can't.
Sure.
They're wrong.
Right. I mean, I think looking at most people, their path is never straight. And I think when you meet people for the first time, oftentimes you think it is straight. And I think that's why having the opportunity to speak with you in this forum is really important for people to hear that the journey is often not straight, but you will get there if you're determined enough. So just want to thank you for the opportunity to hear some of those stories and the powerful words from Dr. Guerrero.
Thank you. I think you just mentioned something very important, be determined. So that will be the last point. Never give up.
Thank you.
Thank you very much.